Hi, my name's Katrine Christensen, and I'm presenting on diphtheria. Diphtheria has many common names, mostly shared with scarlet fever because people used to mix up the symptoms. Some of these are malignant quinsys, throat distemper, and malignant croup. Here's a little history on diphtheria. The first written record of diphtheria was written by Hippocrates in the 4th century BC. Later, there was a huge epidemic in Europe in the 17th century, which then crossed over to the U.S. colonies in about 1735. Friedrich Loeffler was the first to identify the diphtheria bacterium. He used Koch's postulates, which led to the antitoxin being developed about 10 years after in the 1890s. Diphtheria is gram-positive bacillus and is also a member of Actinobacteria. The way the infection works is the bacteria gets into the respiratory system and attaches to the tissues via villi. That bacteria combines with specific bacteriophage that has the right genetic information to produce a toxin. This toxin destroys eukaryotic cells and creates a pseudomembrane and can infect the bloodstream, damaging the heart, kidney, and nerves. There's only one reservoir for diphtheria, and that's humans. The people who are most at risk are those who are unvaccinated, those with bad sanitary habits, and residents in especially crowded areas. The main mode of transmission is airborne. Respiratory droplets from coughing or sneezing go through the air and into the mucosal routes, so the mouth. In very rare cases, contact transmission is possible. The receiver would have to touch open skin lesions or clothing or an object that were touched by the skin lesions. Some of the signs and symptoms of diphtheria. Symptoms develop within 2 to 5 days after infection, beginning with a sore throat. Then comes weakness, fever, and then swollen neck glands, which is where you get the bull neck that you can see here. Also, pseudomembrane develops. It's a thick gray coating that builds up in the nose and throat. It develops in about 2 to 3 days. Diphtheria can cause blocking of the airways, myocarditis, which is damaged heart muscle, polyneuropathy, damaged nerves, paralysis, lung infection, respiratory failure, pneumonia, thrombocytopenia, which is low platelet count, proteinuria, proteins in the urine, and even sometimes death if not treated. Diphtheria is divided into manifestations based on the site of infection. So there's the pharyngeal and tonsillar, which is the nose and throat area, anterior nasal, which is in the upper nasal cavities. It actually presents itself like the common cold. It's the least effective of all the diphtheria strains, as that's just a bad place for the toxin to take hold of the body. There's laryngeal, which can either be a site on its own or in addition to the pharyngeal and tonsillar. And then there's cutaneous, which is where we get the skin lesions. The infection rates. Before the vaccine was created, diphtheria was one of the most common causes of illness and death among children. In 1921, 206,000 cases and 15,520 deaths were reported in the U.S. In the 1940s, the diphtheria vaccine had been created, and there was the whole universal childhood immunization program, so it became much more well contained. Diphtheria, as a general in the world, is more prevalent in tropical countries rather than industrialized ones. In 2014, 7,321 cases were reported to the World Health Organization, but many more are suspected. With the whole Andrew Wakefield argument and the decrease in vaccinations, much more serious outbreaks are possible. One, for example, the Russian Federation and newly independent states of the former Soviet Union in the 1990s, they reported more than 157,000 cases and 5,000 deaths. They lesson learned, and in 2002, Russia reported fewer than 1,000 cases. Treatment for diphtheria. When a patient first comes in and complains about stuff like sore throat and fever and the buildup of the pseudomembrane, doctors look for these symptoms, and if they suspect diphtheria, they send swabs in for testing, and they can even start treatment before the results even come in. Treatment is an antitoxin and antibiotics, such as penicillin. If the pseudomembrane is blocking the airways too much and the patient can't breathe, a respirator is necessary. The patient is isolated until they aren't contagious, which is about 48 hours after starting treatment. After they finish their antibiotic treatments, the patient is tested again to make sure that the bacteria is no longer present in their body. The best way to prevent diphtheria is simply to get the vaccine. There are 4 vaccines that are available: DTaP, Tdap, DT, and TD. All of these also contain a vaccine against tetanus. Tdap and DTaP also prevent pertussis, which is whooping cough. DTaP and DT are made specifically for children under 7 years old, and Tdap and TD are made for older kids, teenagers, and adults. All of the vaccines, it's a series of 5 shots. The first is given when you're about 10 months old, and the final one is between the ages of 4 and 6. But boosters are recommended for everyone every 10 years. Here are my resources. Thank you for your attention.